The next phase of the process is the objective assessment, also known as the physical exam. Now, the purpose of the physical exam is to confirm our diagnosis. Now, normally by the end of the subjective assessment, we should have a clear idea of the areas involved, and we are essentially going in to confirm that diagnosis and also to get a hands-on feel of what we're dealing with. So generally speaking, the objective assessment will start by me observing the patient. I'm looking for posture, I'm looking for muscle bulk, I'm looking at the color of the skin. I then move forward to touch certain parts of the body. I will feel for the muscle tension. I'm feeling for the resistance in particular joints inside. And once I've done all that, let's say if we're looking at a lower back problem, I'm then going to ask the person to bend forward as far as they feel comfortable. It's very important to clarify that, because you might have a patient who's come in with a lot of chronic issues and a lot of pain. And here we are trying to push them to do things which they've been purposely avoiding for a long time. So to reinforce that, you really want to make sure that you're asking the person to do things that they feel comfortable with. So the first step is to get them moving, and we are observing how much movement they've got and how they're reacting. I'm looking for facial expressions. I'm looking for particular muscle changes. And once we've done all that, if possible, we are feeling for resistance in the muscle, and we're also checking for the power, the strength in particular muscles as well. Now, by the end of your objective assessment, we want to have a firm diagnosis. This is what we found. These were the things that we can work on, and we have to find a way to pass this information on to our patients without scaring them. Now, if we start using a lot of medical jargon like your scans normally do, the patient is going to get very worried very quickly. So I normally like to use very basic language, terms like, particular muscle is tight, or a particular joint is a little bit stiff. I do spend a little bit of time educating the patients with their scan results. Now, a lot of people will have ultrasound scans for shoulder problems, or they might have a general x-ray for the neck or the back. And for more complex cases, patients might come in with an MRI scan. And I do spend a few minutes with the patient explaining to them what they're talking about and what this means. And most of the time, these changes that they report in the scan would be quite typical of people which don't really have any symptoms at all. So if you went out there and scanned a lot of different people out there, every scan you do is going to show something different. Now, just because that particular change is there, it doesn't mean that that is the problem which is causing your patient's symptoms. It's very important to educate people. And once we have a bit of a plan, and we've told the patient these are the problems, we then transition on to the treatment phase.